I would wish to give the status update as far as the Mpox disease is concerned, the situation as it is, and this is what I have to say. One, we want to confirm as counties that the only confirmed cases are the 5 cases that have already been confirmed, as reported by the Minister of Health. We are working very closely with the Minister of Health, Public Health Department, especially on the issue of the disease surveillance and monitoring. My appeal to all the county governments is that it seems like this situation is not something that was just a passing, because we have 5 different confirmed cases in different parts of Kenya. There are suspicions every day, and the situation that our people are not able to identify exactly what is the real Mpox and what is resembling the same. And when and until the case is confirmed by testing, then we cannot be able to say that we have Mpox. I know this morning we had an outcry somewhere in Isiolo, and we have asked that the samples are taken and the test to be done so that we can be able to confirm the same. For now, this situation is not very much different from what we have seen with the COVID, and therefore I cannot say the counties are not exactly in a situation to handle the issue. We just need to activate our systems. For one, activate their emergency response centers and ensure that we have a reporting system where there should be a number that members of the public can call if they suspect such a case. Number 2, I request our counties to prepare isolation centers, however small they may be, because in the event that right now we have a patient who is identified in a county, we cannot put them in the same ward with the other patients. We need to have an emergency isolation center in every county. We can have 1 or 2 hospitals that are prepared to handle the same. The other hand, of course, we need a budget to deal with this. We know it's an emergency. All counties normally have emergency kitties, but we need counties to prepare to ensure that the kitty is activated to the extent that if the funds are required to deal with the situation, we cannot be able to wait. Therefore, we need a budget either from the emergency kitty or from the public health to be set aside and be ready for utilization if required. Otherwise, we will not be able to contain this situation. But I also want to ask the members of the public not to panic, because 2 cases already that were identified as the first cases, the patients are already healed. They have recovered. We have not reported any fatality from this case, but we do not know what would happen if we got situations of patients who have other situations or other medical conditions that may affect their immunity. So we do not take it for granted. We need to take it seriously, but we at the same time cannot really make the public be in a panic situation. So as counties, we promise we will continue collaborating with the Public Health Department. We will have a meeting next week to brief all the governors on the situation and what we need to do. But let our public be aware and report, because we have the medicine that's required to live this situation, and that is what counties need to focus at the moment. Make sure that we have the treatment available in our counties, and we have the personnel also that can be able to deal with the same.